night, and at least 4% of girls between the ages of 15 to 19 are currently either pregnant or have recently given birth. 24% of adolescents have not resumed school when schools reopened in January this year. This is according to a report released by the Ministry of Gender, dubbed Kenya Adolescent Report. Zainab Mohammed has the breakdown of those numbers.
According to a report released by the Ministry of Gender, dubbed Kenya Adolescent Report, 4% of girls between the age of 15 to 19 years are currently either pregnant or have recently had a baby, with 16% of girls and 8% of boys reported to have failed to return back to school when schools reopened in January this year after the COVID-19 break.
During this COVID, a lot of boys went to border. So, and that means they were either became children labor or they were experiencing difficult times that they would not experience if they are in school.
The report further indicates a total of 75% of adolescents have reported missing meals during the pandemic, lack of access to learning materials affecting 7% of adolescents in the country.
And if the COVID had a negative impact, it is to a group or a segment that is already undergoing an identification crisis. So coping with a hard and difficult problem, we must address that and think how we are going to provide a solution.
The gender report further indicates that nearly half of adolescents have been affected by symptoms related to depression, 52% of boys and 39% of girls estimated to have undergone physical violence. 50% of adolescent girls have reported lacking sanitary towels, early marriages being estimated at nearly 100,000 cases. The report proposes a number of recommendations to counter the worrying statistics, among them return to school policy for pregnant adolescents, development of a strong multisectoral policy approach to address adolescents' health and well-being, and joint interventions by the health and education sectors. Zainab Mohammed, T47.